I'm Dr. Woerner. I'm the owner of Oaks Veterinary Wellness Center. And the topic of tonight's video is preventing dental disease in our pets. I feel very strongly about prevention of disease, but especially prevention of dental disease. There's so many animals out there that suffer from dental disease, and most of our owners aren't even aware that their pets are so affected. So the purpose of tonight's video then is to discuss why do our pets get dental disease? How can we prevent it? What are the products that you should be using for prevention? I'm going to start with anatomy. Anatomy, real quick review. Anatomy, dogs have 42 teeth and cats have 30 teeth. And whether or not they're a German Shepherd or they're a Chihuahua, they still have to fit 42 teeth into their maxilla and their mandible of their mouth. And cats, of course, even smaller heads. I'm holding a simulated dog skull and then, of course, a cat skull. And fitting 42 teeth in a head this size, so this could be a Chihuahua skull as well, is going to be quite a challenge. And what happens is that the teeth become overcrowded. Food material gets stuck in between the teeth. Bacteria proliferate. The bacteria start to secrete a substance around them to actually make a biofilm, which protects them. The bacteria then start to accumulate in other places in the mouth. So this is called the plaque formation. It happens really quickly. So once the bacteria start creating plaque, then within 36 hours, that plaque starts to turn into tartar or calculus. Tartar and calculus, really hard to remove. It's made of calcium, magnesium, iron. Even in a dental, we sometimes have trouble getting it off the teeth with instrumentation. So it's not something that you can do at home, but what we're hoping is to teach you how to prevent that from happening. So the time to start dental prevention products is when your pet's young. A lot of people make the mistake of thinking they can wait till the pet's like 3 years old before they can start. Well, puppies and kittens get their permanent teeth by the time they're 6 months of age. So once they get their permanent teeth, that's when you have to start prevention, because they need those teeth for the next 15 years of their life. And if you don't take care of them from the beginning, there's going to be dental disease for sure. So the anatomy, the pathophysiology of dental disease, it really makes sense when you think of it from that standpoint. They don't brush their teeth every day. I can't imagine what my teeth would feel like if I didn't brush my teeth for a day or 2 days or a month. So I know we can't make parallels to our pets always, but when it comes to dental disease, I feel that's kind of a fair comparison. So it is our job to try to help them along. And lucky for us and them, there are products that can really help. So the time to start, like I said before, is before it's too late. So the gold standard of preventing dental disease is still brushing. Same with people. Brushing your dog and cat's teeth, you need the right equipment. You need the right toothbrushes. It's an example of a dual-headed dog toothbrush. Larger end, smaller end. Quick simulation of brushing teeth in a dog. Of course, you lift the upper lip with your fingers. You don't have to open their mouth to do this even. There are lots of videos on YouTube on how to do this, so I'm not going to go into a lot of detail. Put the toothbrush on an angle. You don't want to go sideways. You want to put it on an angle. The reason you do that is you get up between the tooth and the gingiva, and that's where the bacteria like to hide. So you want to get in that little crevice, and you want to make sure you really kind of, you don't want to be too rough, but you want to maybe make a circular movement and kind of get up in that little sulcus. And then when you get to the incisors, there's 6 incisors on the top and 6 on the bottom. Those teeth, I typically take the toothbrush and do it this direction, almost like you're flossing. When I clean teeth, I find hair wrapped around these teeth. I find all kinds of grass, all kinds of things wrapped around these teeth. So really make sure you get to those teeth as well. The canines, the big fang teeth, there's 4, 2 in the upper, 2 in the lower in dogs and cats. They tend to accumulate tartar and calculus as well, so you really want to focus on those teeth as well. Really get aggressive and kind of get those teeth really as clean as you can with your toothbrush. So toothbrushes come in a variety of sizes, of course. You're not going to use a giant dog brush on a cat. So we have smaller toothbrushes. We have little finger brushes for cats. They come in all different sizes. They all are going to be sort of better than, you know, using your standard toothbrush because they are designed for pets. So make sure you ask about the products. Usually most of them come with at least a sample of toothpaste so you can try it first. And it's a great idea to just start this when they're young. 6 months of age, you should already be brushing their teeth. So don't wait, start early. So that being said, if you're one of those people that inherited your dog later in life, the dog's life, and they say, absolutely no way will I let you brush my teeth. And believe me, I inherited one of those as well, so I know what it's like. So there are some alternatives. Dental treats, the next line of action. So this, you can do a lot with dental treats. They have become so sophisticated now. The Oravet chews, they work both enzymatically and abrasively, so they can break down some of the minerals that accumulate in tartar. The same thing with the CET veggie dents. They actually have some more natural ingredients in them. They actually have a probiotic in them. They have something to help with the breath. So there's a lot of great products out there. Both of these products, especially Oravet, has been approved for a while. If you can look in the very low corner, there's a little logo there, it says VOHC. That's a Veterinary Oral Health Council. It is an organization founded by some veterinary approved dentists that evaluate products and look for safety and effectiveness. And they've actually shown that these products, if they meet VOHC standards, can reduce tartar by 20% in a 2-month period. Some of the products that are approved up to 70% effective. So it's definitely a better standard. These products, if they have that seal on them, are definitely going to be a little better products than what you might just pick off the shelf. But always check with your veterinarian to see which products they recommend. So these are specifically for dogs. Cats, cats still are going to be harder. Some cats will like treats, some cats won't. This is CET IntelliDent cat dental treats. Greenies, I feed my cats greenies. They still are good dental treats, and they are also VOHC approved. So great idea to always have some treats on hand. The other recommendation I have is that they get tired, at least dogs sometimes get tired of one, so maybe have a backup. Try a couple different kinds and talk to your vet about that. So dental treats, second line of prevention. Always have them around. Great. Supposing your pet doesn't like to chew, sorry, that's gonna be tough, but we luckily have other products. For dogs that like to chew too much and are too aggressive, sometimes people turn to harder things. That is not a good idea. I see so many dogs every month, every week I should say, that have broken teeth, and the number one culprit is, guess what? Deer antlers. Deer antlers, very bad. They're too hard. Any kind of bone that is too hard can fracture teeth. So cooked bones, never. Dehydrated bones, never. Smoked bones, please don't ever feed your dog smoked bones. They will get completely constipated from them. So those are some no-nos. Also nylabones, they used to be like the in thing. Don't use nylabones. Dogs love them so much that they chew their teeth down to little nubs and they have nothing left. And then you have to extract the teeth because they're down into the root canal. So we just don't want to have to extract teeth if we don't want to, especially if we can prevent it. So be careful with your aggressive chewers. You may think you're doing them a favor by giving them bones, but just be really careful. So the dogs that don't, and the cats that don't want to chew on treats, there are some products that are actually rinses. So you can squirt something in your dog or cat's mouth if they tolerate that. This particular one is Cleansident, made by Siva. It's a drug company, of course, but it's a chlorhexidine flush. Chlorhexidine is a compound that is a great antibacterial, antiviral. It is a great all-around antiseptic. So it's a great thing to use, especially after dentals, to rinse their mouth with this to just decrease the bacteria, help healing. But, you know, is it going to do a lot as far as if your dog already has tartar? No, it's not, but it is a good prevention product. So these little rinses are wonderful. They have to be used twice a day. It's a little labor intensive, but, you know, it is another product we have in our arsenal. There's another line of products called Vetradent, and Vetradent. I'm sorry I don't have any to show you, but if you go to their website, they'll talk all about it. It has a technology that actually has the ability to bind the calcium and also the iron and magnesium, taking it away from the bacteria. The bacteria basically die, the tartar and the plaque starts to sort of loosen up. It's losing its, you know, vitality, and it sort of flakes off. And that's the premise behind how this product works. The product has been received very well in the community of dentists. So it's a great line of products, something else that we need to consider in our arsenal of treatment. It comes in a rinse, it comes in a spray, it comes in an oral additive, an oral water powder that you add to the water. So Vetradent products are becoming fairly popular in trying to help that calculus and tartar formation from ever forming on the teeth. So just another idea. So we have our oral rinses, and like I said, Vetradent also makes a spray that you can use and spray in the dog and cat's mouth. So that's the next line of products, our rinses. Now, you know, some dogs and cats are not going to let you squirt something in their mouth. That's just life. They're just not going to be that cooperative. So luckily we have another line of products that have been developed that you just add to the drinking water. So adding it to the drinking water, great idea. However, you have to make sure that they're actually going to drink it. So there are lots of products. Great idea. I always say, if you're going to use the products that we recommend to add to the water, make sure they have fresh water in addition to their water that's treated. These products are safe for dogs and cats, so if you have a mixed household, you don't have to worry about that. But I always worry, are they drinking enough water? So just make sure if you're going to use a water additive, that always make sure they're drinking enough. That's very important to overall health. So we have gone through most of the products that, you know, are either applied or you know, add to the water, but there also is one more level of products, and that's actually veterinary dental diets. So there are diets that are specifically designed to have the abrasive properties to get in between the teeth. So when they're crunching on these hard dental diet foods, they're actually helping to clean their teeth. They probably aren't the kind of diets that I would recommend, looking at the ingredients, looking at their manufactured kibble. That's another whole topic for another video. But if you have a dog, say an Italian Greyhound that, you know, needs to have its teeth cleaned every year, or some of them need every 6 months, a dental diet might be a great idea to sort of throw in there. Maybe feed a dental diet in the morning, feed its regular diet at night. They might have their place in a special situation like that. The most important thing for you to realize is that you may not be able to do any or all of these. Don't feel guilty. Just feel that you at least have taken the time to watch this video and learned more about it. Consult with your veterinarian. We're here to help you. We are not going to judge you. I will never judge you. I had a dog that I couldn't even lift his lip to look at his mouth. So I completely understand. We will work with you to come up with the best solution. Just please ask for help, and please bring your dog or cat in for their annual exams. And if you smell bad breath, not normal. If your dog has red gums, not normal. These are things that are really, important clinical signs you need to recognize and bring your dog in for an exam. Thank you so much for listening. We look forward to your visit.